Hi there, I'm Dr. B. Nice to meet you.
Nice to meet you too.
Can you confirm your first name for me, please?
It's Tia.
Okay, wonderful. And I have you down here for a head, ears, eyes, nose, and throat exam. Is that correct?
Yes.
And is there anything bothering you today specifically that you came in for?
The last couple of weeks I've been having more and more headaches.
Headaches, okay. Are you experiencing anything right now?
No, but I experienced something this morning.
Okay. On a scale from 1 to 10, 1 being no pain at all and 10 being excruciating pain, what are you experiencing right now?
I'm at about 2.
Perfect. And what about when you get those headaches? On that same scale from 1 to 10, where would you say they fall?
Probably around a 5.
Okay, so uncomfortable for sure, not debilitating consistently though, okay? Is that accurate?
Yeah.
Okay. And can you point to me where you're getting those headaches?
It's like right here, kind of on the sides.
Okay, wonderful. So we'll take a look at everything. Make sure there's nothing else going on. I'm just gonna start by sanitizing my hands. May I touch you? Yes. Okay. I just want to take a quick visual inspection of the head, especially where you said you felt that pain. Do you remember falling or any impact?
No.
Okay. How long have you been having the headaches?
It's been about a couple weeks now.
Okay, perfect. So, I'm not seeing any major redness or impact spots or anything like that. Check this side. It's about this here, you said, right?
Mm-hmm.
Okay. Is it really painful when I touch? Tenderness when I touch?
Yeah, it's a little tender.
Anything in the rest of the head?
Not really.
Okay. Just gonna feel around for any lumps or bumps. I don't see any hair loss or thinning. It's very nice and thick and consistent, which is good. Just doing an overall check of everything. Right. Just want to look. I'm going to start with your head and just basically work your way down. So first I'm just going to palpate everything. Any pain when I touch your sinuses like that?
No.
Okay. And what about here?
No.
How about right on the eyelids?
A little bit.
And tear ducts?
That's good.
Okay. Just going to feel any swelling. Everything looks symmetrical. Skin looks good. I'm gonna take your temperature here. Any other illness, symptoms?
No.
Just the headaches. Okay, it's gonna go around back behind your ear. Let's just check this side. 98.7, so that's perfect. So let's just take a look first at your eyes. And are you wearing any glasses or contacts on a regular basis?
No.
No. Can you just look up for me, please? And look down. That all looks really clear. I'm going to shine a bit of a light here. I want you to just stare straight ahead. Just ignore me. Pupils do react. Shine right in the middle here. Okay, I want you to stare straight into the distance. Ignore me completely. And then look at my pen. Can you follow it out? Follow it in. At what point does this become double vision?
Right there.
Right there, okay. And it's normal here. Okay, so I'm gonna hold it about here. I'm gonna move it side to side. I want you to just move your eyes, not your head. Checking for any nystagmus. Any pain in the eyes? Does this cause headaches at all?
A little bit.
A little bit of discomfort, okay. Does it feel like a straining feeling at all?
A little bit, yeah.
Perfect. I want to take a closer look into your eye here. It is going to involve me getting quite close, so apologize for any pizza bread. That looks fine. Function of the eye looks intact. Do a bit of a vision test. So do you generally have any nearsighted or farsighted issues?
A little bit of farsighted.
Can you see this midline here?
Yeah.
With both eyes open? Okay, can you try reading it forwards for me?
OLCF.
Okay, and what about this line here?
EPHCO.
Okay, I'm gonna have you cover one eye up and choose which one you wanna cover up first. I'm gonna have you read that same line backwards.
OZTPE.
Good, and switch it back. And read this line for me.
CHOHJ.
Very good. Okay, so there were a couple missed ones there. The right eye seemed fine and was able to read. The left eye seems a little weaker. Let's try some other tests covering up that eye there. Just hold that there. And I'm going to do the same thing. Just stare straight at my nose and tell me when you see my fingers wiggling.
No.
Okay.
No. No.
Good. Can you switch eyes for me, please?
No. No. No.
Got a little more peripheral on the right side as well. Again, stare straight at my nose and just tell me which side, left, right, or both, is moving.
Left. Both. Right. Right.
Okay, can you tell me how many fingers I'm holding up?
2.
Okay. So just making a note of that. There definitely is a little bit of weakness on that left eye. And that could be causing some of those headaches if the eye is straining constantly. You may not feel like you have a lot of vision problems because your right eye seems to be 20/20, but I would say you're more 30/20 on that left side. Check your color. So I'm just going to show you in just the general color of this. So generally, what color is that?
Blue.
Okay. And what about that?
Orange.
And
Pink.
we'll just test a little bit of the logic here, as long as we have this. So if I put these two colors together, what color would I get?
Green.
Okay. And can you see the green?
Yeah.
Okay. All right, so my instinct is to say that eye pressure may be coming up and into the head and causing that pressure. Have you ever felt the left side's worse than the right at all?
Maybe a little.
Okay.
Yeah.
So I think you should have a full eye vision test and have to go to the optometrist. You may need to get some lenses that are specifically designed to accommodate just one eye. And we also want to make sure, I didn't see anything floating in the eye. There's nothing wrong with the red reflux behind the eye. But with the vision being a little bit abnormal, it's definitely worth getting checked out. But I do want to go ahead and check the rest of your head and neck and throat just to make sure that those headaches aren't coming from anything else obvious.
Sounds good.
So let's look at the ears. And you do have several piercings here. Any issues with those?
No.
Any pain when I press on the pinna?
No.
here.
No.
Same thing on the other side. You have one little freckle there. Take a closer look at that. It looks like, was there a piercing here at one point?
Yeah.
And has that been fully removed or just out today?
I lost it.
Okay. It does look like it's probably still intact as far as you'll be able to put something else through it, but it looks well taken care of. And look inside the ear. Any itchiness of the ears or redness? Ears are clear. A little bit more wax on that side, but nothing too major. But let's test the hearing. I'm going to cover one of your ears. I'm going to whisper in the other, and I want you to repeat what I say, okay? Jelly.
Jelly.
Okay. Dog.
Dog.
All right. So you can hear that just fine. I'm going to make some soft noises, and just want you to tell me left, right, or both. Keep those eyes closed.
Both. Left. Left. Right. Both.
Very good. I'm going to hit this tuning fork. I'm going to place it right in the middle of your head here. Tell me if you hear it more on the right side, the left side, or equally. Again, close your eyes.
Equal.
Perfect. Can you hear this behind the ear here?
Yeah.
And tell me when it goes away.
Now.
Okay. Tell me when it goes away again.
Now.
All right, same thing. I'm going to hit on this side.
Now.
Okay.
Now.
Very good. So hearing seems completely fine. Take a look at the nose now. And can you just cover one side and breathe in for me? And the other side and breathe in. Sounds pretty clear. Any dripping or colds this time of year?
No.
Okay, so I'm just going to take a look at the outside of the nose. Looks nice and symmetrical. Any pain with this?
No.
Okay, I'm just going to look up. Ding. Nose is nice and clear. And we'll do a couple of smell tests here. So I've got a few scents here, and I'm just looking for the general ballpark. They don't have to be perfect. Can you tell me about what that smells like? What type of scent?
Lavender.
That's perfect. And same thing with this one.
Mint.
Any issues with your taste in the mouth? Okay. I'm gonna just look and inspect everything. Can you clench your jaw for me? And does that cause any pain radiating here?
Not really.
Okay, same thing here. Clench. Okay, good. Muscles are good. Open and close for me. No popping. And then just quickly open up and say ah. Okay. That's all fine. Just gonna quickly look at the teeth. And that looks good too. Can you puff your cheeks out for me? Okay. Can you push your tongue on the inside against? Just checking for strength. Very good. And can you stick it out straight and move it left and right? Okay, great. No drooping. And put it in. Open against my hand with your chin. All right, wonderful. Now look at the cranial nerves now. So if you could smile for me. Just check for symmetry. And lift the eyebrows up as far as they can go. And don't let me push down. Good strength. And close your eyes nice and tight. Don't let me open. Okay. Can you move your head all the way you can that way? Just looking for the range of motion here. Does that cause any discomfort or pain?
No.
Okay. Sometimes the tension in the neck can lead to headaches as well. And come all the way back. Same thing there. That feels okay.
Yeah.
Good range of motion. Push against my hand, and then on the other side, come back, push against the hand. Can you go down as far as you can go? Again, that's okay.
Mm-hmm.
Okay, and push against my hand, and then go as back far as you can go. And hold it there. Good strength. Go ahead and shrug your shoulders for me. Very good. Let's move on to the neck here. I'm just going to look with my light. Any pulsations? I want to feel your lymph nodes, looking for anything swollen that could indicate that maybe you're having some stuffiness or headaches from viral issues. Any pain when I'm doing this?
No.
Okay, checking down here. Just in the shoulders. There's just a couple right in here as well. I don't feel anything, so that's really good. Should check the ones behind your elbow. Okay. So everything looks fine, but I want to test a couple neurological things because we want to make sure that headache's not coming from any swelling or changes in the brain function, okay? So the first thing I'm going to do is a little bit of sensation testing.
Mm-hmm.
So give me your hand.
Mm-hmm.
You see how that's soft like that? I'm going to put it on your face and I just want you to say yes when you feel it.
Yes. 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 Yes.
Okay. I'm going to do a bit of a sharper edge now. And again, you know, it's not sharp. It's not going to hurt you, but you feel the difference between this and this.
Mm-hmm.
Okay, so just look straight ahead and say sharp or dull.
Sharp.
Mm-hmm.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
Very good. Got a bit of a cold edge there.
Mm-hmm.
Does it feel cold here
Yeah.
and here? Okay, which is colder, this or this?
My left cheek.
Okay, which is colder, this side or this side?
Oh, right.
Okay, same thing here.
Both.
They're equally cold. I'm gonna hit this just like I did with the sound, except it's gonna make a bit of a buzzing. You feel that on your skin? And just tell me if it feel vibrating here
Mm-hmm.
and here.
Yeah.
Okay. Does it feel vibration now?
No.
Good. How about now?
No. Yes.
Okay.
Yes. No.
Okay, very good. Got just a little puff of air, and I just want you to close your eyes and tell me not only if you feel it, but if it also causes any a nerve discomfort up into the head, okay?
Yes.
You feel it?
Yes.
No discomfort there?
No.
Okay.
Yes. Yes.
Anything tingling or anything like that?
Not really. Yes. Yes.
Okay, we try in that head area there. That feel okay?
Yeah.
Okay, same thing on this side. That'll feel alright?
Yeah. It's okay.
I'm gonna poke you with that same stick here, and I just want you to say yes when you feel it.
Yes. Yes. Yeah.
Does it cause any pain?
A little bit.
Just a little
inside.
tender?
Yeah.
Okay. Right
Yes.
there?
Yeah.
Okay. And you still feel it here?
Yes. Yes.
When does it start to feel discomfort?
Like kind of the closer it
Oh,
gets.
like more up in here?
Yeah.
Okay. So that feels a little uncomfortable by the temples area right there. Okay. Again, another reason that I believe that it could be your eyes and that bothering you in that strain there.
Yes. 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 Yes.
Very good. Show me how you'd use a comb. Okay. And how would you look at a watch? All right. Can you hold up 4 fingers for me? Okay. And can you tell me what you had for breakfast this morning?
I had avocado toast.
Amazing. So to me, that seems like your brain functions are fully intact. You know where you are right now?
Yes.
Where are you?
At the doctor's office.
Okay, wonderful. So you know who you are, you know where you are, you know how to do basic functions, so I'm not worried about any neurological deficit at this time. So I'm going to go ahead and write you a referral to an eye doctor, an optometrist, to get a full workup, because I definitely think that that will help with some of those headaches.
Sounds good.
Do you have any other questions for me today?
No, that's all.
All right, well, thank you so much for coming in, and I hope you feel better soon.
Awesome. Thank you.